You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Cathy Biase, and I'm a holistic nutritionist and a professional cancer coach. On today's show, we welcome back Dr. Amelia Kelley to discuss her new book, Powered by ADHD, Strategies and Exercises for Women to Harness Their Untapped Gifts. In her latest work, she offers practical strategies and exercises that empower women with ADHD to use their gifts for everyday success. Her book is backed by the latest research on the benefits that exist with having ADHD and is a practical roadmap for women to take charge and harness their enormous strengths and talents. This book offers women with ADHD who are ready to embrace their neurodiversity, ways to manage challenges and to unlock their full potential. Dr. Amelia Kelley is an integrative, trauma-informed therapist focusing on motivation, empowering survivors of abuse and relationship trauma, women's issues, highly sensitive persons, healthy living, and adult ADHD. Dr. Kelley is an adjunct professor in counseling at Yorkville University, co-host of the Sensitivity Doctors podcast, a regular contributor on Psychology Today, and a nationally recognized relationship expert featured on SiriusXM and NPR, exploring the impact of gaslighting on our society. If you listened to my last show with Dr. Kelley about gaslighting, you'll realize how informed she is on her topics. A wonderful speaker. You are bound to learn so much from this show. In particular, we discuss how to embrace neurodiversity for women, how women with ADHD can utilize their diagnosis to boost productivity and achieve goals, and how to overcome real challenges with tools to address issues in the area of work and home life. Please do stay tuned. We will be back in just a few minutes to speak with Dr. Kelley.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase.
Welcome back to the Health Hub, everybody. Please do follow us on our social sites. We are on Instagram, Twitter, and X, and we are at the Health Hub RMC on those locations. Dr. Kelley, welcome back to our show.
Thank you so much for having me. I'm excited to be here.
Nice to have returning guests, and it says a lot to you as a professional and the projects that you continue to work upon. So the new book that you have out, Powered by ADHD, is fascinating to me. Again, the focus is on women. Why did you do that within the context of this particular book?
So when it comes to women, the research has been grossly behind. It really was not until the early 2000s that women and girls were even included. And we see a huge discrepancy between appropriate and timely diagnosis in women and girls. And that has so many detrimental effects. In fact, there's a wildly robust and, dare I say, slightly flashy study that just came out of the UK about ADHD and longevity and mortality rates that we should definitely touch on today if you want. And one of the things that really stood out to me is that in history, women's life expectancy was classically longer. But when you look at the study, women's life expectancy, according to the study, was 2 years shorter than men. And I think a lot of that has to do with underdiagnosis and underutilizing treatment.
And are you talking with this study within the context of ADHD? Like, I don't think many people would assume that life is shortened by that diagnosis.
That's exactly what they were looking at. They looked at 30,000 different individuals who had ADHD. And so you're right. And that's why the study it just came out, and it's shocking, but rest assured it is based on old research as well. This is not something we didn't know. It's just being repackaged. And essentially what it's saying is that when it comes to ADHD, it's not the actual neurodiversity, or to define ADHD, attention deficit hyperactivity disorder. It is a neurodevelopmental disorder where the brain develops a bit differently and sometimes normally more slowly. And it can impact, the way that the brain processes dopamine, uses it to motivate, sends signals from different areas of the brain designed to help us focus and, execute executive functioning. So it's not the actual neurodevelopmental disorder itself that causes issues with mortality. Instead, it is the secondary or comorbid issues that impact it. And I'm happy to unpack that in whatever way you want, because there's a lot of information involved in this.
Well, I think this sets up for discussion about the book and the questions that I have to follow. So definitely unpack to where you think is logical.
Okay. So when we look at comorbidities, a few things stand out. Things like anxiety disorders and depression and substance abuse are going to be more prevalent in folks with ADHD. And the reasons vary. With substance abuse, those with ADHD sometimes will tend to self-medicate with certain substances, especially if they don't understand that they have the disorder in the first place. For example, I have a client I was meeting with yesterday who is in recovery, and now that recovery from alcohol, and now that she's in recovery, she's realizing, and she's about 7 months sober, she's coming to realize that all this time she's been using alcohol to quiet her brain. Mm-hmm. She's been using it to, shut the constant humming off. And what she's now understanding is that now that that's removed, we're needing to find other coping mechanisms and other ways to treat the racing thoughts. And so things like that, there's impulsivity issues that can cause mortality. If those with ADHD sometimes tend to have higher prevalence of car accidents, according to research, speeding tickets, things like that, some reckless behaviors. But this is also very connected to their environment, their upbringing, whether or not, unfortunately, they find some correlation between ADHD and lower education rates, or SES. And this can be, if you think about it, if someone is not given the right tools and the right ways to hone the powers that ADHD can offer, it can make it really difficult to succeed in education and in your profession. However, I'm seeing the contrast where my ADHD support group that I run every other week is only with women. And boy, oh boy, those women are high achievers. They've got really impressive, I don't want to say resumes, like they need a resume to be in the group, but what they've done with their unique brains is just beautiful. So there's this contradiction here where we need to understand that, in my mind, I wish we didn't call it a disorder. I wish we called it attention deficit deviation, because it's a different type of brain that we've seen also has hugely adaptive abilities. And I will add one other thing. There's a couple health concerns specifically when it comes to ADHD and longevity and mortality. Some of them include things like cardiac issues. If you're not working closely with a provider that understands how stimulants impact your unique body, it can also have an impact on things like diabetes, which is really wild. And I postulate this is not something that I've read, but I was unpacking this with another professional the other day, and we were thinking about the fact that people with ADHD are, deeply impacted and sensitive to dopamine. Dopamine is something that is spiked easily through things like sugar and unhealthy foods. So making sure that you're managing your ADHD with a holistic approach can also help impact things like type 2 diabetes. We are not talking about type 1 diabetes here.
Mhm.
And then finally, when we look at health, if people with ADHD are struggling with executive functioning, that allows them to prioritize making health appointments like checkups and getting to the doctor and getting their prescriptions in. You can see how, if not managed, there can be this trickle down effect where there's secondary health issues that can impact longevity.
What about primary health issues leading to your to the study, and I'm sure the work you've done, to the observation of a rise in diabetes? What about an inflammation connection? And where, and again, I don't know much about this, but if someone's brain is not firing off as supportive to the hormonal processes that take place, especially within a woman's body. Can this be a direct link to an inflammatory pathway?
I have not read that. I'm happy to look more into it, but I don't necessarily suspect that would be a direct connection because of the way that ADHD works. So what we have with the neurology of ADHD is that what you actually have is the brain firing too much. And that's why it's called hyperactivity. It's not actually called hyperactivity because of our classic understanding of those kind of externalized symptoms that were even more observed in research on boys and is still present in girls. But, something I explored in my book was the difference in how ADHD can present in females. And we can get to that, of course. But the inflammation piece, the one part that I could see logically making sense would be that if someone with ADHD is in a heightened state of stress because of, say, masking behaviors, maybe they're working extra hard to keep up. One of my favorite quotes is telling someone with ADHD to work harder is so counterproductive because the person with ADHD is probably working harder than any other neurotypical person in the room. And so that would be where I could see the inflammation hypothesis potentially working out, where if you have someone who's in a heightened state of stress because of trying to keep up and because of racing thoughts and irritability or kind of physical agitation, maybe presenting from the disorder, but the actual neurobiology of the way the brain fires causing more inflammation because of ADHD, I do not necessarily see anything that would support that.
Okay. Now, when it comes to the clientele you're trying to hit, obviously women. Now, are you working more with women who have not been diagnosed with ADHD or women who have been carrying this diagnosis through childhood?
A little bit of both. And I will preface, in my actual practice, I do work with quite a few men as well.
Okay.
Just the literature is really, it's already out there supporting both genders and very much supporting men. But the amount of really supportive, robust literature, and I like to call it science help, where it's, self-help based on research, really was, in my opinion, kind of lacking for women. And so that's why I was trying to reach a little bit of a hole in the market, essentially, people who need it and who deserve that support. But as far as the women that I do see, because you were asking specifically about women, I think it's a 50-50 split. I've had women who come in with secondary disorders. They believe that maybe it's anxiety or chronic fatigue syndrome or just trauma. And as we work and realize that they're hitting a wall in a lot of areas of their life and that they just kind of keep coming up against a struggle, they come to realize, and I come to realize with them, maybe there's something else going on here. So I'll usually screen for kind of like the big three, We've got ADHD, autism, and high sensitivity, which all have some overlapping traits. And so I screen in my practice pretty much for all three all at the same time. And that means, yes, I'm having, folks do the RADS assessment for autism who probably are not qualifying at all. But I really like to make sure that we're covering kind of, those three primary facets of neurodiversity that we do see a lot of overlap in. Now, as far as women who come in already diagnosed, I do have a handful of those. And when they come through my door, it's usually because they've received a medical diagnosis. They might be getting medical intervention like medication. And now they're working through, shame resilience and failure schema and narratives of not being good enough or not being able to get things done. And they just really want to feel empowered and feel good about themselves amidst the news that, they have this beautifully unique brain that just needs different support.
Well, maybe I'll leave this to the second half. But when we're talking about the difference between men and women, or when we're talking about when you're diagnosing or going through the processes of neurodivergency, what are the traits that stand out to you that would allow you to make that diagnosis?
So when we're looking at ADHD in general, we want to be looking at how it's impacting the way that you function in your everyday life. And, classically, I remember hearing something like where it had to show up in all areas, school, work, and home. I have to say, as I'm learning more about the reward that dopamine provides and hyper focus, I don't necessarily fully believe that anymore. I think if you have an area you are really excited about and you receive a lot of dopamine from, usually that's where ADHDers excel. And so, but for the most part, you're going to be looking at things like having difficulty staying on task, having difficulty organizing, struggling to remember things, losing things, having issues with time, being on time. Inattentive traits a lot of times are going to be a little bit more like, drifting off into space when being directly spoken to. Feeling there is a lot of research out there, and I would not be surprised if the next diagnostic manual has a diagnosis or at least a subset for something called slow cognitive tempo, which has some overlap with the inattentive traits. And then when you're looking at the impulsivity piece and the hyperactive piece, because we're looking at we're looking at hyperactive type ADHD, inattentive type ADHD, and combined type. And with strictly hyperactive type, one of the questions is, do you run about in the room? Do you have a hard time taking turns? Those are things that I think when you ask a child, it resonates a lot more. But with an adult, I'll say things like, if you're in a board meeting and you're starting to drift and feel distracted, do you have the craving to run around the room? So it might not be that you actually go and do it, because by the time you're an adult, you've established some, kind of ground rules for yourself and ways to restrict and restrain yourself. But do you find that you're fidgeting a lot? Do you have a hard time sitting still? Things like that are very commonly associated with more the hyperactive type.
And are people how do I say this properly? Can adults come into this diagnosis out of nowhere? Or is this something that a person deals with as a continuum from childhood into adulthood? Are there newly diagnosed is not the right word, but can traits happen later in life?
Yes, for certain reasons. And that was one of the reasons why I was so interested in speaking about women, because as women, we experience obviously cyclical hormones, and throughout our life, those change. And so some women do find an uptick of symptom presentation during pregnancy, during menopause, perimenopause. There's a lot of variety and variability between just even 1 month. So you can find with a woman that during certain phases when hormones are at a better balance, their symptoms are more manageable. Whereas during the phases where, you're kind of ramping up, you're PMSing, you're right before the cycle is usually when your symptoms become worse. Things like anxiety can increase, executive functioning can be impacted. So that's one area that I was very interested in exploring. When it comes to kind of spontaneously being diagnosed as an adult, a lot of times that correlates with a child or one of their, relatives being diagnosed, often their children, because of the heritability of it. And so that's why a lot of people in their adulthood may receive spontaneous diagnosis. Another thing could be things like traumatic brain injury. So certain health disorders or certain health traumas can increase ADHD presentation. And another thing too is if you look at the fact that women specifically were not being diagnosed as often as young boys, we'll say girls were not being diagnosed as often or as readily, even though it's an even split. And, when we look at the genders, you're not more likely or less likely to be diagnosed if you're either gender. So I think there's a variety of reasons, but we can also look at the fact that some children, if they have, according to research, if they have less hyperactivity physically, so if the way that it presents is a little bit less physically hyperactive, and they have a deeply supportive environment, and they're given a lot of resources, sometimes those children can kind of age out of some of the symptom presentation and it won't be as prevalent in adulthood. So when you look at the statistics, there are, statistically speaking, somewhat more children diagnosed than adults, mainly because of that.
So if we take it back to where we started, the research that now is focusing more on the women's health there, which, and women's health research is starting to become prevalent in many areas of health. We are really starting to understand that we are not just weakling men. Is it the hormonal piece that you find the most compelling for this research?
I think the hormonal, but honest to goodness, the societal expectations on women, and the fact that, getting back to the longevity piece, when we look at mortality in women versus men, before women, and I say this wholeheartedly as a working mother, and I love my work and I wouldn't want to trade it. But when we look at classically that women had, a role, a more singular role socially, they were running homes, and some were working, but less were doing as much as they're doing now. We look at the impact that had on their health, and that now as women are just packing everything on, like we are kind of mentally doing the full load of what we were doing before, and it's like ... and running businesses, working, starting companies, just being amazing, honestly. But when we're not taking some of that mental load and, making an equitable spread with it and allowing, society encouraging everyone to take their equal part in the mental load, I think that has such an impact on executive functioning in women and presentation in women. And we also look at masking behaviors. So classically speaking, I hope this is changing, but the old school thought of, women not being at the forefront, not being loud, not being big, kind of being demure or feminine, that old idea of what that looked like, I think it encouraged masking behaviors that would force girls to internalize their ADHD and feel shame about it and not be able to live at large and be it, kind of holistically be the full scope of themselves. So this is changing and evolving, and we're talking about it, but we shouldn't ignore it either.
Agreed. We're going to take a break, everybody. When we get back, we're going to talk about the flip side of this diagnosis and maybe talk about some strategies for coping, but really maybe take a nice look at some of the positivity that can come out of a diagnosis like this. We'll be back in just a few minutes.
You are listening to The Health Hub here on Radio Maria Canada. a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biase.
Welcome back to the Health Hub. Our guest is Dr. Amelia Kelley, and we are going to, now her new book is called Powered by ADHD, Strategies for Exercises for Women to Harness, strategies and exercises for women to harness their untapped gifts. And the reason I'm reading the full title to you is because I think that we want to spend this half of our show really getting an understanding of the power that people can have that have this diagnosis with harnessing the traits that this brings with it. So enough of me talking. Dr. Kelley, part of your book, a chunk of your book is devoted to helping women get coping strategies so that they can turn these traits into something empowering. Can you talk about that for us?
Absolutely. And it's probably my favorite part. I think, as I had said earlier, this idea of it not necessarily being a disorder, however, it should be seen as such so that we can make sure we medicate and support and give people the right accommodations. And I don't want to, create an environment where we only just get excited. You have ADHD. It's okay. It's really okay to feel lost or frustrated or concerned or worried. I have this disorder. How do I handle this? It's very natural. And so I think when you look at ADHD as not just a disorder, but as Tom Hartman said in his book on, the farmer versus the hunter, that it really is an adaptive trait. It is a different type of brain. I've often said that if we look at the way our society functioned before the kind of not industrial revolution, but before this whole technology revolution or boom, when people were hands-on, when people were physical and out in the fields or in factories, when they were physically doing things, I truly believe that people with ADHD were not identified because they were the ones that were excelling professionally. They were getting their needs met neurologically. They were getting movement. They were getting action, and they were thriving. But we look now at the way our society has shifted as, technology has changed. We're asking people to be so sedentary, so metaphoric, so kind of just cognitively conceptualizing work instead of always going and doing the work, if that makes sense. And so we add that to, the influx of screen time and the way that we eat and the way that we sleep and the way that we function. And I believe it doesn't exactly support ADHD brains the way that they need. So what does that look like? Like, what does it look like to support an ADHD brain? As I explore the book, there are some amazing gifts. When you set up your life in a way that works for your brain, you're going to notice things like your ability to hyperfocus and get a lot done in a short period of time is an ADHD gift. People who can knock out, I think it was the book called Boy in Striped Pajamas. Have you ever heard of that book and that movie? Mm-hmm. Did you know that was one of the quickest, and I get, it's very much based on true historical facts, but it is a fiction. Did you know that was one of the fastest fictions written in history?
I had no idea.
Yes, and it's a great book. I'm sure the editing took a while, but I would not doubt if we sat down with that author that he probably has some form of creativity and hyperfocus that comes from ADHD. That's just my suspicion. I don't want to start a rumor, but it's that kind of stuff. That ability to block out the world and excel and feel really confident in something as you're doing it is what hyperfocus is all about. And ADHDers far excel everyone else in this area. Creativity. Interestingly, research has shown that people with people with ADHD are able to conceptualize outside the box far beyond their neuronormative or non-ADHD counterparts. This was seen in a really interesting study where folks with ADHD and without put side to side, creating a unique animal. Okay, so designing an animal that doesn't exist on Earth. Those without ADHD took from their past experiences and were able to form these really unique animals. But people with ADHD were able to gather and think of things that had never even existed in the world to create their productions. Like, how amazing is that? So we've got those things. We've got the gift of energy, which is really, I think, kind of correlates with hyperfocus, but it's just different when you take the energy that's available to someone with ADHD and you give them the right setting and the right supports. So that's the one thing Tom Hartman's work was looking at, where he saw those with ADHD as the hunters, like the people who, could excel when they're boots on the ground, going out, doing the thing. And this can equate in our modern day to things like entrepreneurs, business owners, leaders, CEOs, people who also are just like deeply creative and, get out into the world and start ideas. I think classically there was this idea that there's only a handful of jobs that work for people with ADHD, when in fact it could be anything you want. It's just, do you have your farmer there to help you? And so what this looks like is, if you are someone with ADHD and you have something you're passionate about and you want to do, trying to get someone in place who can do the things that you find monotonous and that you are not driven to do can help you then excel in your areas of focus. I sometimes joke that, that's why I have like 6 people that do different things for me, like accountant and bookkeeper and, all these people that do the things that I would never want to just sit and kind of putter through. So, tapping into your dopamine reserves, what drives you? And then, I had talked with you a bit about the fact that people with ADHD also have they're incredibly in touch with empathy, because folks with ADHD are shown to have a bit more of emotional mirroring, where when they're not in their flight of ideas, or if they're feeling insecure or masking their behaviors, and you just kind of are allowing yourself to be fully yourself in a social interaction, there have been studies that show that people with ADHD can actually show deeper empathy based on different areas of the brain firing than some of their neuronormative counterparts, aside from, highly sensitive people, which is another form of neurodiversity that is sometimes common and comorbid with ADHD.
Now, is this empathy a detriment to them?
It certainly can be. That's a good question. I love this distinction. Empathy and compassion are completely different on a physical level. You've heard that before? Right. And so for your listeners to understand this, empathy actually causes inflammation and reduces immune function in the body. So we need empathy to kickstart compassion. But empathy is, as we know, putting yourself in someone else's shoes, feeling bad when they feel bad, even seeing someone on a TV screen in distress can fire areas of our immune system and our body to have an empathic response.
And I argue you don't even have to see someone in distress. You can anticipate what might be coming down the road. And for women, that is one of our superpowers, as well as, in my opinion, it can be a burden.
I completely agree. And I think half of that is societal and half of that is biological, because there have been studies that show that mothers, and I'm just using mothers and fathers because this was the study done, but mothers who play with their children get a spike of feel good connection hormones. But when fathers play with their children, they actually get more of that hormone. But when mothers nurture or comfort, and we're talking about oxytocin, the love hormone, the feel-good hormone, right? When women nurture or comfort, they get a higher spike of oxytocin than when fathers do. So there's this really wild biological thing that's ingrained in us to serve these different purposes when rearing children. So if you take this kind of natural tendency to get more oxytocin and, all these feel-good hormones when you're nurturing, it makes sense that we are drawn to constantly be nurturing. But what happens if you cross over from nurturing to rescuing, where you are the one doing all the kind of emotional heavy lifting? That can put you at a risk of empathy overload, which was your original question. And for those with ADHD who are already more likely to be emotional sponges, you then add in being a woman, and we've got like the triple whammy. So compassion, however, is the antidote. Well, compassion and boundaries. So compassion is the mobilizing of empathy. Compassion actually has a positive impact on your immune system, reduces the inflammation response, and increases feelings of efficacy and empowerment. And so, when we think about compassion, let's say hypothetically, you read about someone across the world who's in a war zone, and we can't, you can't do anything in the moment. There's things you can do, but you can't literally go and help this particular individual in that moment. That can be really overwhelming and distressing. And enough of that can cause emotional fatigue and physical fatigue and inflammation. So I often tell folks something as simple as a metta meditation, which is like a loving kindness meditation where you specifically are well wishing for someone, it can actually shift an empathic response in the body to be more restorative and compassionate so that you're doing something good for the world, even if you can't physically go help that person in that moment.
Excellent. When it comes to strategies for people, for women, acceptance has to be in place, I assume. And then we move on to particular strategies. Are they uniquely different for everybody, or are there patterns to the strategies that that you can offer up to the people you're working with?
I would say when it comes to men and women, I think the strategies are very similar. If we take out the piece about hormone balancing with women's cycles, pregnancy, perimenopause, menopause, all of that has its own subcategory, which I have a full chapter dedicated to in the book. But things that I'm normally looking at is what systems does someone have in place? For example, someone who does not have ADHD might remember to purchase greeting cards for their family for like a birthday, something like that. It might be, oh, it's springtime. They get triggered by, the smell in the air, and they suddenly remember, I got to remember to go get that card today. And so they leave work and they're like, what was that thing I was going to remember? Oh, right. I have to go pick up a card for my mom, something like that. This is kind of a typical thought process that can go through a neurotypical brain. I think most of us, however, being so overloaded just with the way our society is kind of set up, that we can do too much work all the time. I think, honestly, with technology, all of us really could benefit from ADHD coping skills. However, people with ADHD must use these skills. And so if they want to live their best life. And so one of the things I really work on with people is that folks with ADHD have to have more cues. And this can come in the form of alarms. It can come in the form of a sticky note. It can come in the form of a signal on your calendar. But a good visual is that someone with ADHD, if they have things they have to do and they open up the different tabs on their computer, if you minimize or get rid of that tab, it could just be gone. It could be gone until the task is no longer, at the forefront and suddenly it's late. So the ideal situation for someone with ADHD is to find the system that you like the most, that you find the most rewarding and easy, and to consistently use that system. And I also try to encourage people not to have multiple systems set up where you're partially attending to one and partially attending to another, because that doesn't cause enough of an urgency cue. So not only do we want cues, we want urgency. And so this could be in the form of compressing time. That's something I work on with people with ADHD often, is that research shows that people with ADHD actually do better with micro semesters than they do with, say a 6-month long semester where you have projects the whole time. There's this use of strategic procrastination where you kind of, I have to say honestly for myself, I form these kind of, I don't know, illogical deadlines that aren't actually true, but they put pressure on me. Like if I have a vacation coming up, for instance, let's say I have a project that's due in 2 weeks. Actually, this is exactly true. I'm going on vacation tomorrow. We're taking our kids to Disney World if we can get out of here with the impending snow in North Carolina. And I have this PESI training that I'm putting together, and I'm supposed to get the slides to my guy. And it's really not due till the beginning of March. But I don't even want it on my mind. So I set this false kind of false deadline for myself that it had to be done before the trip when it actually didn't have to be done before the trip. But it created this sense of urgency with time compression that forced me to do it in a time where I had more dopamine going because I really just want to get it done before this trip. So I think if you can create these false deadlines that cause healthy time compression, it can be very helpful if you find the specific calendar that you like that works well for you. However, with a caveat, people with ADHD like novelty. And so sometimes you have to change systems. That's okay. The worst thing I think is when someone I work with ADHD gets hard on themselves about changing their system up all the time. If you are willing to holistically pull everything you need into a new system and just focus on that new system, if it gives you more dopamine because it's novel, go for it. Just please don't separate your systems. That's what I'm asking folks, not to spread it out, but to have it narrowly focused in.
So ideally, children who are diagnosed with ADHD would be taught all of this as well, in the capacity of the age, obviously. With extending into the adult space, is there a large need for medication to control impulses and to control behavior? Or are you of the mind that, once identified, strategies and coping mechanisms can do the job?
I want to answer both questions. I just want to say one thing about children, if that's okay. I was running a workshop on being powered by ADHD, and it was a live Q&A, and this mother had asked about her son who just cannot remember to bring his homework to school. And she wants to empower him to be able to do this on his own. And he's a rising 8th grader going into high school. And I leaned heavily with her into growth mindset, which we haven't even brought that up at all. The thing of it is if he's struggling to remember his homework, it is because he doesn't have a cue. He didn't have an urgency and there was no cue. There was no visualization that was being presented to him. It was someone was expecting him to function like his neuronormative counterpart and just remember to put the homework in his folder, just like I had casually remembered to buy the card for my mother after work. Instead, what I was saying to her was, if you sit down with someone with ADHD and you ask them, empower them, what would be the easiest way for you to remember your homework? Would it be that I place it on top of your folder at the end of the day? Would it be that we have an alarm that goes off at 3:00 for you to place it on top of your book bag? Like, what is going to create this cue, this urgency, and this signal to you? So I think checking in with the particular person about what works best for them and making sure it's urgent, there's a cue, and that it's available. But without expecting someone, Russell Barkley said it best, we can't look at behavior modification as a permanent fix. We have to look at it as a prop. So we wouldn't expect someone with paralyzed legs to use a ramp enough times where they no longer need the ramp for their wheelchair. They're always going to need the ramp. So these behavior modifications are the ramps, and they should permanently be put in place anytime you find something that works for you. So I can use that to answer your question about medication. This is literally the most commonly asked question I get asked about to medicate or not. If you, as an individual, have been able to put enough ramps in your life where ADHD is not causing you distress and you feel like you're able to hone in on your strengths, it's not impacting your relationships in a negative way or your work. And I will say, we haven't even talked about exercise. A lot of folks I work with, and this was what I studied in my doctoral dissertation, was the use of high intensity interval training for folks with ADHD versus medication. And I did find that high intensity training, this can be something as simple as 10 minutes a day of rigorous exercise that gets your blood pumping, can give you about a 3-hour boost of focus on average. Right. And so if you look at being able to capitalize on these different things, if those things work for you and you can find supplementation, whether it be fish oil or ashwagandha or, different food modifications and really prioritizing sleep, and you don't need medication, wonderful. Like, that's great. That means you're managing your ADHD. But for many people with ADHD, that's just not enough. And so that's the question that I ask. Is your life being negatively impacted despite all these efforts? And with children specifically, what I'm most concerned about is their ADHD preventing them from fully socially developing. If they're being ostracized in their class, if they're being left out of social gatherings, if you feel like they're being targeted by teachers and not being given the right support, like if you feel like it's going to impact their confidence, because children with ADHD receive on average up to 10,000 times more redirections by adolescents than their non-ADHD counterparts, which you can see how that would impact someone's self-esteem and confidence, right?
I'm just thinking that this must be exhausting for people to try and constantly manage.
Exactly. So that's what I look at. Is quality of life being negatively impacted by ADHD in a way that these managerial skills are not working? And then even when you are medicated, for example, my husband is medicated for ADHD and he takes it the days that he's working, and then he doesn't take it over the weekend. I'm not giving medical advice to do this. You have to check in with your provider and make sure that they're okay with that, because some providers would say differently based on your unique biology. But there's different ways to also work with the medication. There's also medications that you can take at night that don't kick in for 12 hours or so, roughly, so that it helps folks wake up in the morning. There's medications that are non-stimulant if you're someone who has addiction issues. So there's so much nuance that I want to encourage people, if you are going to go that route, please speak to someone who specializes in this, and not GPs are they're the best thing that has happened to our medical system. We need them. They serve a huge purpose. But they're not always going to be the best, most well-versed resource for ADHD over the span of the medical community.
Fair enough. Unfortunately, we've come to the end of the show, and it's been a fascinating conversation. For someone like myself who, this is not something that I know much about. But just elucidating everything that you are doing or everything that you've done it's enlightening. I find it very enlightening. Your book, as I mentioned earlier, everybody, Dr. Amelia Kelley's book is called Powered by ADHD: Strategies and Exercises for Women to Harness Their Untapped Gifts. I'm assuming we can find this on all the normal
everywhere.
Spots to grab a book. And thank you so much for taking the time again to come on the show and share this with us. It's just great work. And, it's an honor for us to have you on the show.
Oh, thank you so much. It's so good to see you again.
Everybody, we will talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by